Hi everyone, I'm Dr. Foluke. We'll be talking today about morning sickness, also known as emesis gravidarum. This is the nausea and vomiting that is associated with many pregnancies. In some cases, it becomes very excessive, in which case it causes some dehydration, imbalance in electrolytes, and in more severe cases, it could even affect the kidneys. And this is called hyperemesis gravidarum. The cause of morning sickness is actually the effect of the hormones that are produced to support the growing baby or the fetus. Now, this morning sickness usually starts from about the time when a woman realizes she's pregnant. So somewhere about 4 to 6 weeks, and it lasts up to the end of the first trimester, somewhere about 13 or 14 weeks. Morning sickness is more prominent in women who are pregnant for the first time, and it's also more prominent in women who have multiple pregnancies like twins, triplets, and higher order pregnancies. For a woman who has morning sickness, there may be the need to exclude other causes of excessive vomiting, such as, in this environment, malaria, and other more sinister causes of morning sickness or of excessive vomiting, such as a molar pregnancy. And this has to be done in conjunction with your physician or your healthcare provider. And it's advised that every woman should have a first trimester scan as early as possible in the first trimester to rule out a molar pregnancy, especially if nausea and vomiting is very much exaggerated. Now, if morning sickness is established, what do we do? Most of it can be managed with modification of our habits, such as our diet, our lifestyle. Morning sickness can be reduced by stopping a woman from being exposed to lots of strong odors, lots of oily foods, drinks, or other foods that are overly sweet. This is because excessive sweetness in foods can cause a lot of salivation, and this will be followed by nausea and vomiting. So a woman with morning sickness, or any woman in the first trimester, should try to focus more on taking things that are dry or bland and takes lots of water. Some women will not be able to tolerate the taste of plain water, so water with a twist of something is allowed. It's very important, once again, to ensure that a first trimester scan is done. For some women, these modifications will not be sufficient, and the vomiting will persist and actually affect their day-to-day activities. In this case, you should see your physician or your healthcare provider, who will prescribe some medications to stop or reduce the vomiting to such an extent that you can go about your daily activities. Thank you.